few takes. Here we go. May 27th. Thank you for being with us. I've been tied up today, and that's why we're doing this later in the day. Yesterday evening there was a great banquet that was, for an organization called Game Changers. You've heard me talk about them before and everything, and they're all about trying to do anything and everything they can for kids to try to combat this terrible opioid, this terrible drug situation in our state. And they're raising money. They're actively involving a lot of folks now. Coach Nick Saban was good enough to come last night, Senator Manchin, and a lot of folks, that came. I'm very proud to be their head coach, and all through. And hold on just one second. We better make sure that we get situated here. I kind of messed up there. I hope everything's okay. Could you pick up everything up to there? Okay, but today they had a golf tournament, and I was able to play with a couple of good friends and Coach Pruitt, and so it was a good day. We played this morning in an effort to raise money for an organization that is going to do more and more and more good for our kids in this state. It was the first time I played a hole of golf in, I don't know if it's been, 12 or 14 or 18 months. And it started off pretty ugly, but we ended it up pretty good. And to tell you the truth, Coach Pruitt was, he was really, Nick Saban, Coach Saban was playing right in front of us, and Coach Pruitt was really dialed in the fact that it'd be nice if we could some way, somehow come out ahead of Coach Saban, and we did. We shot 57, and that's Captain's Choice tournament, and Coach Saban and his group shot 58, and we came in second, and the only thing I can say is to get here for the briefing, I hit the shot on the 18th hole, knocked it on the green, knocked it about 12 feet away from hole, and I said, guys, I got to go. Y'all can putt that, and y'all can knock that in, and they missed it. And so I just got informed that they missed it, and just got informed how we placed in the tournament, but it was fun, and it was good, from the standpoint that through just these things, and just think about it, through Jim's dream, it turned into Jobs and Hope. Through communities and schools and all the incredible work that they've done, my gosh, they're touching now 40 to 50,000 kids. It's amazing. It's amazing what they've done. And now Game Changers. It is an effort across our state to combat this terrible drug killer. And absolutely, we're going to try to stomp that out just like we have done with this pandemic. We know we've got ways to go on both of them, but we're working at it. And so, good day. I congratulate Joe Bozick, and we really appreciate, Senator Manchin and Gail that were there last night, as along with, Nick and Terry Saban and many others, many others that stepped up and everything, and it was a good night, and so we're just going to keep at it and keep whittling this thing and make sure that we try to do anything and everything we can to help our kids. Okay, back to this. We've lost 10 additional people since Tuesday. One of those folks is a 39-year-old from Wood County, but of those 10 people, in a very respectful and honor way, I want to, call out not their names, but their age, their gender, and their county. And I want you absolutely to always join me in prayer for these great people. Reading 10 is a whole lot better than reading 80, but 10 folks is a lot of folks in West Virginia. And so we'll miss them, we love them, we don't want them to die in vain. Absolutely, we do not want them to go and us not react, and us not to do something about it. And I'll get to that in just a few minutes, but getting about doing something about it is one thing and one thing alone, and that is getting vaccinated. They deserve it. They deserve absolutely your respect for them. The 2,783rd death in West Virginia is an 84-year-old female from Fayette County. The 2,784th death is a 75-year-old male from Logan County. The 2,785th death is a 62-year-old male from Mercer County. The 2,786th death is a 92-year-old female from Monongahela County. The 2,787th death is an 80-year-old male from Mercer County. The 2,788th death is a 74-year-old female from Calhoun County. The 2,789th death is an 84-year-old male from Wayne County. The 2,790th death is an 87-year-old female from Raleigh County. The 2,791st death is a 79-year-old female from Pocahontas County. The 2,792nd death in West Virginia is a 39-year-old male from Wood County. Oh, man. I can't imagine how bad it is. In fact, I know how bad it is to lose a loved one that's 70 or 80 or 90 years old. You know, we miss them. And, but to lose a kid, a 39-year-old, is really tragic. 269 new positive cases in the last 24 hours. That's pretty good. Our daily positivity rate, 4.28. That's pretty good. Our cumulative positive continues to fall. It's at 5.10. That's good. Our active cases are 5,099. Now get this. That's the lowest number of active cases that we've had in West Virginia since October the 29th of 2020. Almost 7 months ago. It's the lowest number that we've had in the last 7 months. We got 153,155 recovered cases and 209 patients that are hospitalized. 81 of them are in the ICU units. We have no red counties. All good stuff. The reminder is, if you're 65 and older, I've told you this 1,000 times, if you have any symptoms at all, for crying out loud, how can you risk it? How can you possibly risk it that you can become one of these names? How can you risk it? Go get tested. And if by chance you were positive, the antibodies would take care of it, but we got to catch it early. Vaccine eligibility is now available to all 12-year-olds and above. We have plenty of supply and plenty of locations where you can get your shots. You know, from the standpoint of the 12 to 15-year-olds, you know, the Department of Ed estimates there's 78,000 of them, of those kids in our state, and students are eligible for the vaccine in our K through 12 schools. We will offer vaccines to all students 12 to 15 years of age with the permission of a guardian. And at these clinics, we will also offer vaccines to all eligible West Virginians, including any other students or parents or anyone, educators, anyone that comes at those clinics, we'll vaccinate them. I've said this over and over, but the people are young people, 16 to 35 years of age and everything. That's the sweet spot. That's the sweet spots where we've got to have your help, parents, grandparents, and everything. Push our 16 to 35-year-olds to go get vaccinated. We need it so badly. That's our sweet spot that we really need to absolutely continue to push our people to get vaccinated. For all those 16 to 35-year-olds we already have in place and everything, you know, from the standpoint of the $100 savings bond or the gift cards and everything, and since the registration opened on Thursday, now we've received a grand total of 20,527 people that that we've got gift cards or savings bonds, and that's on the way to people. You know, that's well in excess of $2 million that have gone out to people, and it's going right now. And so all that's great. You need to visit governor.wv.gov, and you can get your savings bond or gift card by just going to my website. I'm going to touch on in just a second, like I promised you, a whole lot more info about additional incentives. And I'm going to tell you just a few moments how we're not going to let a state like Ohio get ahead of us. They have never been ahead of us, and absolutely, in my opinion, they should never be. And so with all that, we're going to just show you how we'll blow Ohio out of the water, and absolutely, I want all of us in this great state to be absolutely aware and incentivized to please get vaccinated. You know, our vaccine distribution update, we're at 83.2% total administration first and second doses. Our goal is always 100%. Absolutely, with our 65-year-olds and that are out there and everything, get this number. We are at 83.2%. We keep crawling right towards that 85% of our 65-year-olds that have had at least one shot. And I believe wholeheartedly, if you're 65 and you've got one shot, you're going to get the other one if need be, unless it's Johnson & Johnson, and that's the only one you need. Nevertheless, I'm really proud of that. The last time I came to you on Tuesday, we're at 57%. Now we're at 57.5% of our total population, 12 and above, that are eligible. 57.5%. We're on our way tracking towards 65. That's our target to be at by June the 20th. We're going to be close. We're going to be close, and that'll be really good. You know, I've told you about saving our wisdom over and over. You know, we moved on January, early in January and everything to get our older folks vaccinated. We did so. I don't have the exact total, but I can estimate that the total is well in excess of 250,000 West Virginians that are 65 years of age and older that have had at least one shot, and no telling how many folks we saved a life. And that's really great. From the standpoint of our businesses and our church outreach and everything, again, we're asking all of our businesses to call us. Just call us. I mean, for crying out loud, set up, you know, we'll set up a clinic at your place. We'll vaccinate your employees. The same with our churches. We'll vaccinate your congregation, and we're standing ready to do so. All you got to do is just help us a little bit and call us. We'll make it so easy for folks to come and get vaccinated, and, you know, maybe we'll get some additional folks across the line. And that is really, really, really important. I challenge you. I've said it over and over and over. It doesn't take a rocket scientist to figure this out. I mean, when it really boils right down to it, you see me read 10 names today. You saw me do this. Go and tell me one situation that you know of where somebody that's been vaccinated has some crazy reaction to it and we lose them. Our medical experts all the time are talking about this. Do you not think that if that were truly happening in a significant way, that it wouldn't be the number one thing on the nightly news? Do you not think that absolutely, without question, that would dominate the news? If we had people having reactions, negative reactions to these vaccines, it would dominate the news. We're not. This is real. This is real when we read these people that have died. Don't be one of them. Quit being afraid. Absolutely know how much you'll be helping yourself, your family, and lots of others to just be vaccinated. Okay, all the vaccine info line stuff is up there. You know, we're vaccinating in our state parks over Memorial Day. We'll be really after that and everything, but we're vaccinating. It's all up there in wvstateparks.com. You know, in our call to arms stuff, you know, we set out that we're going to, by our birthday of June the 20th, we're going to get rid of these masks. Already, we've been able to get rid of masks, you know, for people that are fully vaccinated. And absolutely fully vaccinated means just this. It means that if you're Pfizer or Moderna, you have to have 2 shots, and then you have to be 2 weeks past the second shot. Johnson & Johnson, you have 1 shot, 2 weeks after that, then you're classified fully vaccinated. If you're that, you don't need to have the mask on. That's all there is to it. You go into public spaces and everything, and we're doing it by the honor system as best we possibly can. But if you're not fully vaccinated, you need to have the mask on. That's just all there is to it. We still believe by June the 20th, we'll have 65% of our people that will be vaccinated, and we'll be able to get rid of our mask, period. You know, that's all I got on that. Okay, from the standpoint of getting tested, our free testing, our testing map is up. You know, we again thank Walgreens and Frith for all that they've done. It's unbelievable, you know, with the drive-through pharmacy testing and everything. You know, if you just go back and you just think about it, and you know, this is like old news, but just what I said the other day, people were scrambling everywhere. They were looking and scrambling everywhere to find a test kit. To just have it, you know, we had so few at one time. We were scrambling all over the place to try to find masks and try to find proper PPE for the people that were right up on the front lines. We were going crazy trying to find, you know, stuff to be able to protect us. And now look where we are. Now we're close to the finish line. We're close. And all we're asking people to do now is go get vaccinated. So, again, utilize the free testing, but we've got to have you vaccinated. From our long-term care facilities, we have 11 outbreaks in our long-term care facilities and 5 in our churches. In 3 counties, we're down to Greenbrier, Taylor, and Nicholas County. We got to get them off so our church people, you know, step up in that community as you've done over and over and help us there. At corrections, we have 6 inmate cases and 10 staff cases all across our state. I mean, is that not unbelievable? I mean, when you think about it, is that not unbelievable? You know, that we've got 6 inmate cases and 10 staff cases all across this state. Corrections, what a job, what a job. I remind you over and over about giving blood, you know, especially if you've gotten through this terrible killer and you've survived and everything, you ought to really think about it. You ought to think really, really hard about going and giving blood. Now, there's a Clarksburg native and a Notre Dame high school student. His name is Ben Long. Now, Ben is going to represent West Virginia at the Poetry Out Loud National Finals, which will be held virtually and nationally broadcast at 7 o'clock this evening. You know, what an incredible student, what an incredible young man. Kathy and I wish Ben the best of the best, and I know he'll make us all proud. He already has in every way. He doesn't have anything to be nervous about. All he's done is lead us to the top and everything. And again, Ben, we thank you. You know, Ben won the West Virginia Poetry Out Loud Championship in March as West Virginia's champion. Ben represented the state at the national. Ben represented the state at the National Poetry Out Loud semifinals. Out of 50, now get this, out of 55 state and jurisdictional champions who competed in the national semifinals, Ben was named one of only 9 high school students in the whole country. He's one of 9 in the whole country who will compete in the national finals. You know, a total of $50,000 in awards and prizes and organizational stipends and all kinds of good stuff will be awarded tonight, including the national champion will receive $20,000 as an award to the national championship and national champion. But what a story. What a story. Here's a little kid from right in our back door who attends Notre Dame High School, and absolutely he's competed, he's won their state championship, and if that's not good enough, then he's gone to the national semifinals, and literally 46 of them have gone. He kicks out 46 of them, and there's 9 of them left, and Ben's one of them. So congratulations, Ben. We're going to watch you tonight, and we're going to absolutely just say big prayers and cheer you on. So thanks again for making West Virginia proud. Thank you, son. Okay, the only other thing I have is our vaccine incentive stuff, okay? Now, here's the deal. Again, I don't see any absolute way that we in West Virginia need to sit back and let Ohio dominate the news. So there's lots of things that we're going to do. You know, and through all this, you know, it's been plenty tough. And so I'm going to ask you from the standpoint of, I've asked you for me, I've asked you for Kathy a bunch of times, and I'm going to just play with you just a second to be a little bit humorous, but I've asked you for all of us. I've asked you for your family to go get vaccinated. You know, today we're going to tell you that we are on the cusp. Now we've got to figure it out exactly how to do exactly all this, because we have got to make sure that all those that are vaccinated can get in the system and be eligible for the drawings. We have people that have been vaccinated for a long time, haven't we? You know, all the way back, I guess, into late December or early January, okay? All those people need to be eligible for these drawings as well. And we're going to draw for college scholarships for kids, multiple college scholarships for our kids. We're going to absolutely draw, and please somebody tell me the name of the pickup truck, what we're going to do with the pickup truck. Is it we're going to have 10 Rocky Ridge F-150 pickup trucks, and I guess they tailor-make those into that. We're going to absolutely, we're going to draw for all kinds of things from the standpoint of, well, of course, we want as many winners as we can possibly come up with. And so in all of that, we're also going to draw for some real big cash prizes. And those big cash prizes, we're going to do exactly what Ohio's already done, but we're going to make a few West Virginians millionaires before this is over. Now we can do that, but we got to get you vaccinated. And we'll give you all the rules and everything on Tuesday, but I would tell you just this. For all of you that are out there, you got to get vaccinated. The drawings will start on June the 20th, and at that time, all those, you could go get vaccinated today, and you would be in the drawing. All the people that are already in the drawing, you know, will be eligible. And you can go get vaccinated today, tomorrow, the next day, and you can be in the drawings as well. And as we proceed ahead from June the 20th, we'll keep drawing. And as we keep drawing, if you're vaccinated, you don't have to have both shots. You take the first shot, you're in. You're in the drawing. So I would tell you just this. I wouldn't dink around with this. That's all there is to it. I'd go get myself a shot. Because absolutely, there's going to be so many wonderful prizes that you can win, it'll blow you away. And absolutely, we want in this state, we want everyone to know, every single person to know, the cost of absolutely, the hospitalization cost, the absolute, you know, cost of sitting around and continuing to go on and on and on with this as far as the testing cost and everything else. We can absolutely save ourselves so much money if the faster we can get to a big amount of our population that is vaccinated, the faster we get there, the more lives we'll save, the more money we'll save, the more absolute back to normalcy we can get. So I brought my little buddy with me. You got to help me just a second. But I brought my buddy with me today, and I want to make you smile. Because if she won't make you smile, I can't make you smile. But I got to show you my little buddy just a second. Okay, baby. Now you sit right here. All right, now listen. If you won't do it for me, if you won't do it for your family, you've got to get vaccinated for baby doll. That's all there is to it. Now, she wants you vaccinated so badly, and she's going to absolutely be the one to lead us through on this, all these incentives, and without any question, she'll give you a high five right now, but you have got to get yourself vaccinated. She wants you vaccinated, I want you vaccinated, and I want a bunch of you to win all this stuff and everything, and that'd be just great. So anyway, I wanted to make you smile a little bit. She came with me today, and appreciate you waiting for us and everything. Like I said, we were doing some really important work earlier today. But we'll get the registration started next week, and we'll start on our state's birthday. We'll start drawing for real stuff. But I'm telling you, and she's telling you too, go get yourself vaccinated right now, right, baby? All right. Thank y'all so much.
All right, thank you, Governor, and thank you, Baby Dog. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Well, I sure wish Dr. Marsh was here today because I hate to follow Baby Dog, but I would like to highlight on a serious note some of the things the governor discussed. We continue to trend in a positive direction, just very slowly. And we need to get people vaccinated. We don't know when the next variants are coming. We don't know what the next challenges are in front of us, but what we do know is this vaccine is safe. It's safe for people of all ages. Dr. Amjad can attest to it. It doesn't cause long-term medical issues for young people or reproductive issues or anything of those nature. So please go out and get vaccinated. We have several events over this holiday weekend. We have plenty of vaccines available. We will be initiating some new ad campaigns to further help educate people as to the value and safety of the vaccine. And as the governor highlighted, 16 to 35 years of age, we need you to step up. Just like your older West Virginians, your parents and your grandparents have done. And please understand, we are in day 440 of running our interagency task force. And to have a 39-year-old West Virginian die of COVID, it just doesn't make any sense to me. There is no damn reason for us not to go get vaccinated and protect each other and protect ourselves. I do want to highlight, too, at the Game Changer event, I had an opportunity to speak with Bernie Dolan from SSAC. And one of the things he reminded me that I need to remind all of our student athletes, middle school, high school, college, if you don't go get vaccinated in the next week or so, and for high school athletes, the July training period's coming into effect, and someone in your group would get COVID, you're going to have to quarantine. But if you get fully vaccinated, you can continue on with your training. So again, on behalf of all of those people from DHHR, the National Guard, all the other agencies that are on the front lines of this, please go get vaccinated to protect West Virginia. Thank you.
Thank you, sir. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good evening. Many people are traveling over the Memorial Day weekend and are going to be enjoying time with their family and friends. The CDC does recommend delaying travel if you're not fully vaccinated. Many airlines do recommend, if you're traveling domestically, to have a COVID test before you're traveling, and you'll need that 1 to 3 days before you travel. So you do need to have that planned. And we do want to remind everyone that we do have many free testing sites available throughout West Virginia. You may also want to have a test when you come back and need that 3 to 5 days after you return from your travels. And also, if you're not fully vaccinated, to quarantine yourself at home afterwards, and that's if you're not fully vaccinated. And to remember to follow any safety guidelines at your destination when you're traveling. So if you are going to travel this weekend, do remember to be safe, enjoy your time away. But also, if you're not fully vaccinated, we do have many sites available throughout West Virginia. So please take advantage of that and enjoy your weekend with your family and friends this weekend. Thank you.
Thank you, Dr. Amjad. Secretary Bill Krause with the DHHR is also joining us today and is available for questions. Dr. Clay Marsh, our coronavirus czar, had a prior engagement today and will rejoin us next week. We'll now go to questions from members of the media. Our first question today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you talk a little bit about how these latest initiatives are going to be funded? I mean, it sounds like the pickup trucks might be donated by somebody. It sounds like our higher ed institutions might be chipping in with these scholarships. I assume the lottery money is going to come from federal dollars. Could you talk a little bit about that? And is there an overall price tag that we've determined yet on how much we're going to spend on this? Thank you.
Charles, we have, I mean, first of all, we still have some older money in our CARES money, from the first CARES money and everything. We're still developing, full details on all the program and everything, but absolutely, Charles, we've got the money in compliance with the rules and all that kind of stuff, and we've got the ability to do this, and we've got these dollars covered.
Thank you, Charles. Our next question will be from Aaron Noon with Nexstar Media.
Hello, Governor and Coronavirus Task Force. Aaron Noon with WOWK Channel 13. I have a question regarding a study that came into our newsroom. It's from Wallet Hub. It says that West Virginia is the least safest state when it comes to COVID-19, when it comes to transmission, positive testing, hospitalizations. And I was just wondering if I can get some reaction to that study.
Aaron, I think, was it Aaron? Is that correct? I don't know what in the world, I mean, I guess you can get a hold of any study, and the studies, are floating around and can say about anything and everything. But Aaron, I just want to go right back to this and just let me make sure, and I'll tell you exactly a stat that you ought to look at and everything. Well, let me just 1 second. Just hang right with me just a second. Well, I can't find it, but I do know this, that Aaron, we have had 5,200 or 5,099, I think was the right number, of active cases today. And if West Virginia is the worst state, and God knows, I don't know why in the world we kind of almost are hoping that something's going to fly apart and everything so we can report West Virginia is dead last or this and that and everything. We have experienced the best, the very, very, very best on active cases in the state of West Virginia that we've had in the last 7 months since October of 2020. So don't believe that stuff. Please don't believe that. West Virginians are 57.5% have received at least one shot, and we've got, like I said, 5,099 active cases now in West Virginia, and that's down significantly. That's absolutely the best day that we've had since October. I couldn't be more in opposition to some study or whatever that you have, because I mean West Virginia is, we all know this. West Virginia's done it, and they've doing really good, and we keep trying to come up with more and more incentives to do better and better and better.
And I believe Major General Hoyer also may want to chime in on this subject as well, Governor.
Governor, I'd just like to add to Aaron, I don't know what the data is that they looked at in that study, but two of the most important things that the governor tasked us to do was to reduce the number of deaths in West Virginia and to make sure that our hospitals were stable. And in both cases, we are doing that exceptionally well, particularly because our people over the age of 50 have stepped up and gotten the vaccine. So I would take issue with the study. If you look at the numbers of while we still are losing West Virginians, and as the governor points out, it is tragic, our death rates have plummeted since the first of the year, and our hospitalizations are well within manageable ranges. We would like to be better, but I think we are doing exceptionally well and are a safe state.
Thank you, Aaron. Our next question will be from June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. I would like any more details we could get on these vaccine efforts that are happening at the state parks. How have they been going so far in terms of numbers of vaccinations or anything else you can tell us? And how do you think they will go this weekend? Are you gearing up in any way?
General, this is you, sir.
Yes, sir, Governor. June, we have a number of parks across the system who are partnered with their counties. So whether it's the parks and the county sponsoring events together or individual events at parks, we think we will get good uptake in that as from both those who visit as well as staff members and family members. We'll provide some more information next week on how those have turned out. But I think the important point is whether it's at a park or, as the governor pointed out, at a business or a state fair, we're going to go anywhere and everywhere. And if we get 10 people, we consider that a victory, because that's 10 more West Virginians that are protected and 10 more West Virginians that won't spread the virus. So we'll continue to update you on the success going forward, and we appreciate the partnership from Secretary Chelsea Ruby and all the folks in the park system and DNR who have supported us with that effort.
Just 1 second. Just everyone just focus on just what the general just said to us. You know, if we get 10 to get vaccinated, you may step back and look at it and say, well, daggone, you know, they went all the way to Capon and they got 10 folks. That's all they got. Just think just about this one thing, and I've said this over and over. How much is saving a life worth? How much is it worth? You can't define that, can you? Neither can I. Of those 10 folks, we may save one life. Who knows? We may even save more than that. Was it worth it? Was it worth it for us to try? Daggone right in my book. So that's what we're going to keep doing. We're going to keep doing anything and everything we can to keep people across the finish line and get them vaccinated.
Thank you, Governor, and thank you, June. Our next question will be from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. We are into Memorial Day weekend this weekend, and I wanted to get the thoughts of Governor Justice and also General Hoyer on the contributions of those who made the supreme sacrifice. Our generation was raised with a lot of patriotic influence. I don't know if we still have that these days, but here's your opportunity to school the younger generation on those sacrifices and what people have done for them, the soldiers of our country. Thank you.
Well, let me lead off, and let me just say this, and then I'll pass to General Hoyer. But, you know, to all those out there, young and old, but especially the young, you know, can you imagine all the stories of, you know, high school kids that were at a prom, and 5 weeks later, they were on the front lines somewhere. I'm sorry, 5 months later, they were on the front lines somewhere all across the globe. They were at a high school prom. And 5 months later, they're on the front line, fighting for every single thing that you have today, and I have today. We owe our life in every way to them. And a lot of them gave the ultimate sacrifice. A lot of them laid in the mud, laid in the cold, absolutely gave everything they had for each and every one of us. Now, some way, somehow, we've drifted away to where we don't recognize that anywhere close to the magnitude that we should. Today, we've got people all across the globe that are West Virginia Guardsmen today. Absolutely, and Guards ladies today. But without any doubt, all of us, each and every one of us, should absolutely have a debt of gratitude, a debt of appreciation that never leaves, never, ever leaves. I have said it over and over. I cannot say it any more proudly. We owe every single thing we have in life, everything we have in life, to those that came before us, to those that are with us right now protecting us, to those absolutely that gave everything they had for all of you and for me. That's all I can say. And if you don't get it, well, shame on you.
Paul, just to highlight a couple of things that the governor pointed out. Unfortunately, we now look at Memorial Day as a day off. And because of the time of the season, a day to go out and fish, or a day to go out on the boat, or whatever it might be, to go golf, we've failed to recognize what's really behind Memorial Day, which is recognizing the ultimate sacrifice of those in service of our nation. But the other thing that I think is important for us to understand is behind every one of those individuals who paid the ultimate sacrifice are families, what we refer to as Gold Star families, families who have to spend Memorial Day not in celebration of a day off or a picnic, but thinking about the loved one that they lost in service of our nation. And unfortunately, in World War II, the entire nation went to war. But unfortunately, as we go forward today, very few Americans are sacrificing to the level that our military families are sacrificing. And I hope we continue to recognize that and realize Memorial Day is much more than just a day off.
Thank you, Paul. Governor, back to you.
I just paused just a second there to say a little prayer just underneath my breath and everything for all those that gave that sacrifice, and all those families and everything, all those that have been affected. It's unbelievable what this great country's done. But they've not done it without a lot of spilled blood and a lot of really, really, really hard work and hard efforts. I tell you almost the same about all those folks that we've lost, the 2,792 people that we've lost with this terrible pandemic. Something that's never happened, or surely hasn't happened in any of our lifetimes, that are here on this earth right now. Something that happened 100 years ago, a pandemic, something that absolutely just wiped away all kinds of great, great, great people from this earth. Now, it's been a battle, hasn't it? And for the most part, we've been in a battle always together, and I hope and pray we will stay just there. Memorial Day, just like the general said, a lot more to it than just a day off. A lot more to it than another golf game or a fishing trip. Absolutely a lot more to it. And especially at this time, right now. For all those that we've lost, through all the years of them giving the ultimate sacrifice, we have had 2,792 more West Virginians that we've lost. And so keep them all, please keep them all in your prayers. And I want to wish you a very, very happy Memorial Day time. And I want to tell you one more time just this, that we're going to start drawing. And we're going to start drawing for some big-time prizes. And absolutely, we're going to make someone a millionaire in West Virginia. And absolutely, we're going to make a bunch of people have, kids have college scholarships and on and on and on. If you don't go get your vaccine now, right now, you know what's going to happen? When we get out close to June the 20th, we're going to have a run on people that are going to be trying to get their vaccines. And when we do that, that's going to be much more difficult, and you may just be one that just didn't get in the drawing. That's all there is to it. And you may awaken to the fact that your next door neighbor won. It could be you. It could be you. You need to go get vaccinated right now before there's a run on the vaccines and everything, and there will be. There'll be just that. It'll protect your life, and absolutely it'll protect your family, and it'll protect loved ones and friends all around you. Go get vaccinated, West Virginia. You're getting better and better and better, but we're not there yet. Come on now. Help me, help you. Please do that. And Nathan, what did you say the other night and everything, because I'm going to use Nathan's saying.
Save a life, change your life.
I don't know how you say it any better. He said, save a life and change your life. You know, I don't know how it gets any better than that. Save a life and change your life. So Nathan, thanks for that, and thanks all of you for, we'll have some fun with Baby Dog a little bit, and we'll have a whole bunch of things that are coming your way. Before there's a run on the vaccines, go get vaccinated, get in the drawings. We'll have a lot of fun with that, and hopefully we'll save a whole lot more lives. So thank you so much.